In Tech Watch, activists are demanding Facebook take stronger action against misinformation on its platform. A group calling itself the Real Facebook Oversight Board descended on the company's Washington headquarters yesterday and placed body bags that read "Disinfo Kills" in front of the building's entrance. In a statement, the group called the social network a super spreader of vaccine falsehoods. So, to talk social media, misinformation, and disinformation, we are joined by Garrett DeVink. He is a tech reporter for the Washington Post. Thank you so much for joining us. So let's just sort of like set the stage a little bit here. I see some misinformation pop up on my various feeds, but not a lot, but I also don't pursue it. So I think I have a real sense of just how much misinformation is out there. So how prevalent is outright misinformation about COVID on YouTube and Facebook, and how does it spread so rapidly?
Right. And I appreciate you saying YouTube, because I think YouTube often gets left out of this discussion, but a lot of this is actually happening on YouTube, and we need to also talk about them in addition to Facebook. But the question is really difficult to answer because we all see different things on our Facebook, and a lot of the things that you might consider disinformation, if someone is seeing that on a regular basis, they're interacting with it, they're sharing it themselves, they would say, no, this isn't disinformation. This is what I think is the truth. And so, when you look at information that medical authorities say is wrong, false about COVID, the reality is that there's a lot of it on these platforms, but a lot of it sort of takes the form of people say, just asking questions, just posting what they say are, this is important evidence to consider. And of course, people should be able to ask questions during the global pandemic. They should be able to ask questions about their healthcare. But what you're seeing is there's sort of a small number of people who clearly sort of have businesses where they essentially are just sharing medical misinformation these days, mostly about COVID vaccinations. Before COVID, they might have been doing it about other things. And then they're also, selling natural products on their website, and they're using this sort of concern, people's hesitancy, people's fear about their healthcare and about COVID to sort of build these online audiences. In a lot of cases, some of their posts might be getting taken down, but a lot of them are staying up, and it's still something that's quite prevalent on these platforms.
Yeah, I think it was in your article, you spoke a little bit about a documentary, in air quotes, that came out in the summertime that did pop up in my news feed with people that I knew. And, right away I was like, oh, this is obviously fake. And then, literally within an hour, there were like 10 to 15 other people that had been sharing it. And I thought, whoa, how did that happen so fast? And so it was so obviously not accurate information about the virus. Is there any way, though, to quantify the real-world harm done by misinformation spread through social media platforms? I know people, I hate to say, but even in my family, that have spread some of this stuff. But, I still see them getting the vaccine and putting their mask on. So I'm wondering, do we know just exactly how this misinformation is harming people in real life?
Yeah, I think it's still in that realm of anecdote, but it seems that we all have those anecdotes, right? So if you just look at that and you say, okay, if we're all seeing it, if we all have family members who are saying, maybe in group chats, maybe when we see them at family gatherings and maybe they're still not vaccinated, and you're saying, why not? Like, what's going on? And they reference things and you say, okay, where did you hear about that? Let's talk about it. A lot of them will say, well, I saw it on Facebook or I saw it on YouTube. And so the reality is that this stuff is out there, and these platforms are contributing to this environment where people who have legitimate questions are maybe finding information that is not legitimate. And so the companies both say that they're spending a lot of time, a lot of resources steering people towards better information. If you're on Facebook, I'm sure you've seen a ton of links to the CDC. Same with YouTube. Any video that mentions COVID, mentions vaccines, will have a little link to the Centers for Disease Control to sort of share that more authoritative information. But of course, people who are maybe primed to distrust government, to distrust the medical system, just because there's a link there doesn't mean they're going to click on it and suddenly change their mind. And so a lot of activists are saying these companies need to be much more aggressive in actually changing the algorithms that are just recommending content that gets the most engagement, regardless of whether it's true or not, right? The whole way that these companies work is they figure out what people like to watch, what people like to click on, and then they show more of it.
So then, what is it? Is it that, Facebook, YouTube, Twitter, they got to drastically alter the algorithm? It's not going to work, the way it did in the past. Or is it that, the people who disseminate this misinformation and disinformation are just so clever at working the system? Like you talked about the fact that, it's not always COVID is a hoax. Like sometimes it's, why should we wear masks? Or it's, it kind of like, it's more like planting a seed of doubt as opposed to selling an outright lie, though an outright lies are out there as well. And one of the things that I thought was really interesting in the article is you sort of talk about how even like innocent searches, like even searching COVID-19 on your social media platform could eventually churn up some of this misinformation. So is it that the algorithms need to change and like these companies just need to sort of be honest about the way their algorithms are working and that they really are not willing to change? Or is it that the people who disseminate this disinformation are just so clever?
Well, I mean, I think there's a couple things going on. I mean, I absolutely think, there's a lot of people who say that companies need to change their algorithms. During the election, the most recent presidential election, 2020, Facebook did sort of turn down their recommendation algorithm a little bit in terms of news. And so they act, and people were able to kind of see that, study it, and say, it looks like when Facebook sort of pulled the dial back on recommending news content, it did actually lower the level of misinformation. This is independent researchers who have imperfect information because Facebook doesn't provide perfect data about its platform. You sort of have to do the best that you can with what's out there. But these independent researchers did find that when Facebook sort of did this experiment where they tried to tone down the kind of level of rhetoric about news content on its platform, there was less misinformation. So we know that there is something that can be done with the algorithm. And what the companies are sort of doing is they really don't want to touch the algorithm too much. They just sort of want to, keep it that way, but then also try to push good content. And a lot of people say, well, you can have all the good content in the world, but if you still have, this proliferation of fallacy about COVID, that could lead to unnecessary death.
Yeah, and I think that, it also leads to just even more confusion. People don't know what to believe, so then they lean into what they're most comfortable with, which is sometimes not the most accurate information. Garrett DeVink, thank you so much.